Hello, welcome to part 2 of the Caregiver Empowerment Programme, Mood Difficulties in Children and Adolescents Part 2. This is a NUA Healthcare Services Community Support Initiative supporting children and adolescents with mental health difficulties. Welcome to today's webinar, Mood Difficulties in Children and Adolescents Part 2. My name is Dr. Jill Pollard and I work as a Senior Clinical Psychologist with NUA Healthcare Services. About this webinar has been designed to provide helpful information about mood difficulties and how they present in childhood and adolescence. In part 1, we provided an overview of mood disorders, the different types of mood disorders, how to know if there's a problem, and the assessment and diagnosis of mood disorders. We also looked at the causes. In part 2, we will summarise the main evidence-based interventions and supports for mood disorders in children and adolescents with guidance to additional supports, resources, helpful books and groups. These webinars are suitable for caregivers and family members who are involved in providing care to a child or adolescent with mood difficulties, or for individuals who would like to know more about mood difficulties in childhood and adolescence. So let's look at an overview. We're going to be looking at interventions for mood disorders, strategies for supporting mood, where to get support, and finally a summary. Topic 1. Interventions for mood disorders. Research indicates that psychological interventions for young people with depression or mood disorders tend to be more effective with adolescents than with children. Cognitive behaviour therapy, or CBT, is the intervention of choice and the intervention with the greatest evidence base for treating depression or mood disorders. Interpersonal psychotherapy has demonstrated generally positive results when used as an intervention with adolescent depression. Research also suggests that family therapy can have positive outcomes. Parenting interventions, such as parenting courses, have also exhibited some evidence of preventing and treating symptoms of mood disorders in children. Best practice guidelines based on current psychological research and literature suggest that interventions for young people with mood disorders should focus on the following areas. Firstly, psychoeducation. This simply involves providing information and education on mood disorders to young people and to their parents. In this way, they're provided with information on the symptoms and also the things that they can do to help support themselves. The next part of intervention should include self-monitoring. This is supporting the young person to identify their thoughts and their feelings and also the triggers for low mood. The next part would be focusing on activities or behavioural activation. So supporting the child or young person to engage in activities that promote positive mood. The next step would involve supporting and changing family relationships. So addressing things like conflict and difficult interpersonal relationships. Then the focus would be on cognitions or thoughts. So cognitions refer to the way we think and our thought processes. So this part of the intervention would focus on supporting the child or young person to identify unhelpful thoughts or thinking processes and replace them with more helpful thought processes. The next area is social skills and social problem solving skills. So in this way, the young person would be supported to develop friendships and relationships and to solve conflict. Another important area to focus on is supporting the child or young person with any difficulties in the school environment. So that might involve maybe liaising with schools, maybe providing recommendations to schools. The next part would be medication. So medication is used in situations when children and adolescents have not responded to other interventions provided, or in cases of very severe depression. However, it would not be considered to be a first line of treatment. So the first line of treatment would be something like cognitive behaviour therapy or family support. The next stage would be management of parental mood difficulties. So in this way, parents would be supported to address their own mood difficulties if present. And then finally, relapse management would be part of successful interventions to treat mood disorders. So relapse management is really looking at supporting the child or young person from having a relapse of a mood disorder in the future. So that might involve maybe forming a plan to maintain their progress. So the first part of any intervention should be psychoeducation. So psychoeducation simply means providing information and education in relation to mood disorders. So psychoeducation helps both young people and parents to better understand what a mood disorder is, the symptoms of a mood disorder, what influences a person's mood, so what might be the triggers for low mood, and the influence of thoughts, behaviours, relationships, and physical body on mood. Diagrams and models are often used to simplify, break down, and explain these different influences on mood. This is an example of a diagram that might be used to explain mood disorders to a young person. Cognitive behaviour therapy, or CBT, supports children and adolescents to understand the relationship between their thoughts, feelings, bodily sensations, and behaviour. It works on the premise that how we think affects how we feel and how we behave. By supporting children and adolescents to identify their thoughts and feelings, they can further develop their understanding of this relationship. Helpful and unhelpful thoughts are identified, and children and adolescents are supported to identify how negative thoughts might contribute to their feelings of low mood. Over time, children and adolescents are supported to challenge their thoughts and thinking styles and generate alternative thinking processes or ways of thinking. This is a diagram that further explains the CBT model. So in this way, you can see that our thoughts impact our feelings, how we feel in our body, our behaviour, which in turn impacts our thoughts. And you can see that all of these different areas are interrelated. Through cognitive behaviour therapy, the thoughts and behaviour aspect are challenged and supported in order to change feelings and bodily sensations. So in this way, people are helped to identify their unhelpful thoughts and challenge them and replace them with more helpful thoughts, so to impact how they feel and how they behave. And the other area that's targeted is behaviour. So young people and adolescents are helped to replace unhelpful behaviours with more helpful ones. So identifying activities that are helpful to support mood. So the first part of a CBT intervention would include self-monitoring. Self-monitoring is often introduced at the very start of therapy with young people. This usually involves having the person use a diary to monitor how they're feeling each day and what impacts their mood. So in this way, the young person is helped to identify triggers for low mood, patterns, and patterns of thinking and behaviour that might be unhelpful. It can be helpful to use the following headings to structure diary entries. So firstly, a heading for day and time, then a mood rating 1 to 10, 1 being low mood and 10 being high. Activity that the person was engaged with before the mood rating, so what they were doing, whether they were spending time alone in their bedroom or whether they were out for a walk with a friend. The relationship before the mood rating, whether they were with somebody and who that person was, and then the thought about the activity or relationship before the mood rating, and then their coping response, so what they did in response to the thought and their mood, and then the mood rating after their coping. When introducing the idea of a diary and self-monitoring, the young person might find it easier to start with just the first 3 headings, so the day and time, the mood rating, and the activity, to get in the habit of monitoring their mood before slowly adding more headings as the therapy progresses. So in this way, it will really help the young person or adolescent to track their behaviours and their thoughts, with the idea of later challenging those patterns of behaviour and thoughts. Behavioural activation or engaging activities. So through psychoeducation and diary keeping, adolescents and their families discover that activity and behaviour directly affects mood. So there are a number of activities that can be helpful and can improve mood. So for example, breaking down large tasks into smaller ones and rewarding the young person for achieving small tasks can be helpful. Scheduling pleasant events, so things that are enjoyable for the young person. So that might be maybe watching a preferred movie, going to the cinema, going for a walk, going shopping for clothes if that's something that they enjoy. Remembering pleasant events, so remembering things that have happened during the week that have been enjoyable rather than focusing on the negative events. Engaging in age appropriate challenges, so maybe like a young person traveling independently on the bus, shopping for their own clothes, making a favourite meal or baking. Physical exercise. So we know that physical exercise is really important when addressing mood. So something as simple like taking a walk can be very helpful to boost mood. And then finally, using relaxation skills. So young people can be supported to actively use certain tools like relaxation skills to help them with their mood. So things like breathing or visualization to help reduce feelings of anxiety or worry. So the next aspect of a CBT intervention would look at cognitions or our thoughts. Our mood is very much linked with our thoughts. When we experience negative thoughts, our mood tends to dip or drop. This is especially true with young people. So, for example, if we think the thought, nobody likes me, nobody cares, then we're going to feel very low. So, for example, when a young person is trying to do a difficult task, they may have the negative thought, I can't do this, it's too hard, and I'm so stupid. And this will lower their mood. Psychology intervention can support with tackling negative thoughts. So, as we see from before, the first step might be self monitoring and actually recording these thoughts. Social skills and problem solving. A major symptom of low mood is withdrawal from social interactions and being with peers. This can be especially detrimental for young people. Through social skills training, young people can learn how to track peer conversations, identify opportunities for contribution, making contributions to conversations and activities, and generating solutions to complex social situations. This kind of training can be done individually or in a group therapy format with other young people. The young people are taught the rationale for particular skills. They might observe someone modelling the skills and practice the skills themselves and receive feedback on their performance. So, role plays can be a very helpful tool during clinical intervention to role play conversations with a young person to support them to develop those skills. The next aspect of interventions is family relationships. So often children and adolescent mood is influenced by family relationships. So if the young person experiences conflict, criticism, or over involvement from parental separation or bereavement, they're more likely to experience mood difficulties. Family relationships can be improved through communication and problem skills training with the family, facilitating supportive time and conversations with the young person, and renegotiating role relationships. Typically, these trainings are provided to the family as part of the young person's support plan. And sometimes this training happens through groups that are run with a few families at one time using a specific group program. The other parts of intervention are school intervention. So, mental health professionals or clinicians will sometimes work with young people's schools and teachers to understand their struggles and provide more opportunities for healthy peer interactions. The other area would be parental mood difficulties. Many young people with mood difficulties come from families where one of or both parents have had their own mood struggles. In these instances, parents can be offered their own individual support so they can better support their children. Finally, relapse management. Mood difficulties are often recurring, so while episodes can be treated with intense therapy, it's important that young people and their parents learn to identify and manage symptoms that return and recontact the mental professionals as needed. So, oftentimes, young people and their families can be given certain skills and tools that can help them to identify when the low mood is occurring and to proactively act and use some of the helpful skills or tools that they've learned previously. There are times where medication is used. Medication may be incorporated into the young person's treatment plan if psychological intervention alone are ineffective. This is often done by a psychiatrist or GP. Pharmacological treatments are not recommended to be used for the initial treatment of children and young people with mild depression. Antidepressants in children and young people with moderate to severe depression are generally only offered in combination with a concurrent psychological therapy. So usually it's in conjunction, medication is offered only in conjunction with the psychological therapy. Fluoxetine is the recommended antidepressant for children and young people in the first instance, as this is the only antidepressant for which clinical trial evidence shows that the benefit outweighs the risk. Sertraline or citalopram may be used under specific circumstances. Bipolar disorders often require lifelong treatment with medication, even during periods of stable mental health. So, different medications may be prescribed or removed depending on the presentation of the individual. For example, if the person is manic, depressed, psychotic, or stable. Lithium is the most effective long-term treatment for bipolar disorder and is usually offered as the first line of treatment for bipolar disorders. This is a mood stabilizer. Tom's story continued. Tom attends the local child and adolescent mental health service, CAMS unit, with his parents. All three are very nervous, not knowing what to expect. They are puzzled by some of the questions they are asked by the two professionals they meet for their first appointments. They are seen together first, then one of the professionals talks to Tom on his own while the other talks to his parents. Their first visit takes almost 2 hours, but they leave feeling reassured that they understand Tom's situation a bit better and that there is a plan in place to help him. His parents are surprised to be told that Tom has depression, but feel they understand it a bit better when they realise that Tom has had to cope with a lot of upset in the past few years. There has been a good deal of stress in the family as his parents have been having their own difficulties as a couple and have been considering separating, and Tom has not been able to integrate into the secondary school to which he moved last year. He feels bullied and excluded there. Tom and his parents are told that the plan for treating his depression will involve therapy for Tom and regular meetings with his parents to help them to support Tom's recovery. They are also advised that Tom would benefit from treatment with antidepressant medication. Tom is agreeable to this as he feels so bad he is willing to try anything to help. His parents are taken aback and have a number of concerns. Will he become dependent on the medication? Will it change his personality? How long will he have to take it for? They discuss their concerns with the psychiatrist and are given some written information about the medication. Tom agrees to attend a therapist for help with the problems he had identified. Feeling awful, tired, unable to sleep, no friends, working with the therapist, Tom is helped to come up with concrete ways of managing these problems. He attends weekly sessions for the first month and then at 2 weekly intervals for a further 3 months. His parents, who had not been aware of how distressed Tom was at their arguing, decide that they will get some help for themselves as a couple to help them decide whether to work on improving their own relationship or whether to separate. They meet with Tom's therapist once a month to support the work Tom is doing in therapy, and the therapist gives them some ideas that help with Tom's behaviour at home. Taken from Coping with Depression in Young People, a guide for parents. So let's now look at a recap of the interventions we've discussed. There are a wide range of interventions that can be carried out with young people struggling with their mood and their families. These include psychoeducation, self-monitoring, activities or behavioural activation, changing and supporting family relationships, looking at cognitions or thoughts and ways of thinking, social skills and social problem solving skills, school, medication, management of parental mood difficulties, and relapse management. So a lot of these come under the branch of cognitive behaviour therapy when we look at things like self-monitoring, behavioural activation, and supporting young people with their thoughts or cognitions. And CBT has been shown to be the most evidence-based intervention for treating mood disorders in children and young people. When young people and their families engage in these intensive interventions, there's a very high likelihood of symptoms resolving, and this can be managed with vigilance and support moving forward. Now, let's look at strategies for supporting low mood. Support strategies. As a parent, it can be really difficult to see your child struggle with their mood. However, there are a lot of strategies you can use to support them and encourage them to engage in. Remember that adolescents and children learn the most from their parents, whether that's just through observation or direct activities together. You can do a lot to encourage and reinforce positive thoughts, feelings, and behaviours at home. By being more in tune with your own and your child's mood and modelling positive and healthy ways of functioning on a day to day basis, you can improve your child's mental well being. It's important to also remember the basics: sleep, diet, and exercise for you and your child. Recognizing difficulties in your child. When a young person is struggling with their mood, it can often show itself through angry, irritable behaviour, most often directed at you as a parent. It's very easy to get caught up in this emotional turmoil and respond angrily yourself, further exacerbating the problem. Try to take a step back from the situation and ask yourself, what is going on for them right now? What's going well or badly for them? What might be fueling their irritable mood? While young people may respond with sarcasm or a rude rebuff, it's important to try and adopt an understanding approach to help your child open up to you. Talking to someone, usually a parent, is often reported by adolescents as being the biggest help with managing their mood. So it's really important to persist in trying to support your child or young person, and to try and persist in opening up that communication. Providing a safe haven. It's important to be available to your child, like a lighthouse to guide them to safety. So, promoting a safe haven for them means being available when they need you, being responsive to their emotions and their needs, supporting and encouraging new explorations, delighting in new discoveries, and sharing enjoyment with them, providing comfort and protection when needed, and prompting problem solving, and taking charge when needed also. Providing a safe haven for your child also helps them with regulating their emotions. So, feeling comforted when they're sad or hurt can really help them to learn how to regulate their own emotions. Feeling acknowledged when they're happy, so giving them lots of attention when they're also engaging and when they're also experiencing positive moods, and feeling calm when overstimulated. Keeping a connection. Many young people are reluctant to initially talk about difficulties they're experiencing, which can make maintaining a connection with them difficult. Neutral areas of interest can help foster connection. These can be anything such as TV programs or movies, sports, fashion. These interests can be enjoyed for what they are without focusing on your child's difficulties. The aim is to build a connection and to provide your child with a nurturing relationship where they can feel safe and comfortable to talk to you about what's going on for them. Efforts to connect with your child can be difficult and shrugged off by them. Gently persist with trying to make a connection and learn more about their interests and try and share in them. Setting aside time. It's important to set aside quality time to spend with your child. This can be hard, especially with teens, as they may want their own space. It is worth persisting with, however, and trying to find some ways to spend one to one time together. For example, planned activities, going to a sports match or shopping together, or maybe when they come home from school or during car rides. Look for any opportunities you have where you're alone with your child and turn it from a mundane experience into a space where you can connect with your child and get to know what's going on in their life. For younger children, playtime is particularly important for their learning and development. Um, Playtime can meet the need for attention. It can also support children with their learning as they learn through play, and play builds the parent-child relationship. Play also develops social skills. Children become more compliant when they get lots of playtime with their parents. Rough and tumble play is good for confidence and managing aggressive feelings. And play can just be fun for parents and children. Spending time playing builds your child's self-esteem and confidence and helps regulate their mood. A play should be just 10 to 15 minutes at a time and led by your child. So, in terms of setting aside time for play, there are a number of general do's and don'ts that you can follow to enhance the quality of playtime. Do have descriptive commentary, so do tell them, what's going on and what you're enjoying. Give lots of praise, affection, imitation. Smile, be genuine, have fun, and support them to prepare for the ending. The don'ts: don't ask lots of questions, don't be bossy, don't try to lead. Try to avoid criticism, try to avoid being distracted, and try to avoid directly teaching, competing, correcting, or giving lots of warning messages. Active listening, making time to sit and properly listen to what your child has to say can be hard. You might feel the urge to give advice, to tell them what they need to do, give them advice on everything they say, or interrupt them with your own thoughts. To help your child feel heard and validated, you can use active listening skills. These include giving your full, undivided attention, maintaining good eye contact with them, listening intently without interrupting, paraphrasing what they say back to them so they know you're listening, empathise with what they're feeling. That sounds really difficult. I can imagine how hurtful that must have been. That must be really hard for you. And allowing them to express themselves without trying to cheer them up or talk them out of their feelings. It's not easy to hear your child talk about feeling really low. It's important not to disagree with them, but hear and acknowledge what they're saying. However, if every conversation with your child focuses on their negative thoughts or feelings, this can also be unhelpful. So, balance is really key. It's important to give your child space to talk about difficult feelings and thoughts, but it shouldn't be the only topic of conversation. It may be helpful to have one conversation a day that focuses on their difficulties, while all other conversations try to focus on the positives in their lives. Encouragement. Young children and teenagers thrive on encouragement and praise. So, simple compliments and praise can go a long way to making your child feel good about themselves. It's important that your encouragement is genuine and not over the top, as it can be easily shrugged off. Encouragement and praise should be specific and clear. For example, noticing when your child tries harder or does well at school, thanking your child for doing chores, complimenting them on their appearance, commenting on their good hygiene, praising them for not fighting with siblings. A positive comment on even the smallest sign of progress for a struggling young person can make a massive difference to their self esteem and encourage continued improvement. Supporting with negative thoughts. As we saw earlier, negative thoughts play a big role in our mood. Part of the interventions for children and adolescents with mood difficulties is learning to challenge and replace negative thoughts with more helpful ones. You can support your child to challenge their thoughts. For younger children, you might use a worksheet like this to help them challenge their thoughts. So, as you can see, this is a detective's clue notebook. So, clues I found that my thought is totally true, and clues I found that my thought is not totally true. For adolescents, it may be listening to intently to what they're saying, looking for any negative thoughts or beliefs that I might be sharing, and gently encouraging them to challenge them. For example, I heard you say no one likes you. Is that really true? What about your friend Mary? What about your nana? What about me? Getting active. When children and adolescents feel low, they can withdraw and isolate themselves from everything and everyone around them. By encouraging your child to engage in activities that are meaningful to them, you can support them to withdraw less. Identify your child's values and interests. Think about activities they may have used to engage in and stopped. Talk to them about what they enjoy or find pleasure in. Encourage them to think about new activities that might be of interest to them. Schedule activities. So develop a schedule with your child that balances work with chores, with fun, leisure time. Start with smaller activities to help with early success. So sometimes it can be a simple activity. It could be baking together. It could be going for a walk, playing some football outside. Any kind of activities that get somebody moving and active. So, getting active, break down barriers. Look at any potential barriers that may be discouraging your child from engaging. These could be negative thoughts, beliefs, or feelings, or physical difficulties like not being fit enough. Start small. If your child struggles or refuses to engage, try breaking activities down into smaller and more achievable ones. You can then encourage more difficult activities as their motivation and confidence grows. Social support. Encourage family, friends, and even school staff to support your child. The more people involved in the activity, the less isolating it can feel for your child, as well as building their support network. Positive reinforcement. Use praise and rewards to reinforce engagement in activities and positive behaviour change. Getting active. A good tip for scheduling activities is to use some of the 5 ways to well-being when selecting activities. These are connecting. So meeting friends, having a phone call, gaming with others, joining a club. Be active. Go for a walk, run, play a sport, go for a swim or a cycle. Keep learning. Read a book, learn an instrument, listen to a podcast. Take notice, be mindful. Go on a scenic walk, practice some mindfulness, cook a favorite dish, and pay attention to all of your senses. Give to others. Help a friend with something, join a volunteer group, or give someone a compliment. Sample activity scheduling. So sometimes by making out a weekly planner like this with planned activities can help with low mood. So in this way, favorite activities are planned and kind of goals are set. And sometimes when things are written down, it's more likely that someone will follow through when there's a plan made. 5-minute rule. When an individual is depressed or experiencing low mood, it can be helpful to become motivated to do even the simplest activity. The 5-minute rule involves trying an activity for just 5 minutes. After 5 minutes has elapsed, the individual might choose to continue engaging in the activity or to stop. In many cases, the individual's motivation may build as they start to partake in the activity, and they will often continue doing it. So the 5-minute rule also builds confidence, as the person might learn that they have the ability to focus on an activity for 5 minutes. Their viewpoint might change from the idea that they need energy and motivation to complete an activity, instead learn that completing an activity fosters energy and motivation. This increase in activity usually boosts mood and depressive symptoms. So 5-minute activity could be a 5-minute walk. It might feel less overwhelming than going for a half an hour walk. A 5-minute activity could be drawing a picture. It could be doing a jigsaw. It could be playing a game for 5 minutes. It could be any activity for 5 minutes. Exercise has been shown to be really beneficial in both treating and preventing low mood and depression. And it's associated with less depressive symptoms, better quality of life, and increased functioning. So exercise is really important for positive mental health. Depending on where the person is at, exercise might only be for 5 minutes. Good methods to encourage and motivate the individual to exercise might include the 5-minute rule, scheduling the activity, so making a plan to do it, organising the activity with a friend or family member, or joining a team sport that meet regularly. You can foster engagement by having the relevant equipment ready for the person, so rackets, runners, swimming togs. Exercise can be simple activities such as throwing a frisbee, dancing during a song, or poking a slitter around the garden. Self-care. When anyone is struggling with their mood, particularly low mood, it can be very difficult to know what to do if what you're doing is right. While there are lots of strategies out there, don't forget about the basics of self-care: sleep, diet, and exercise. So focusing on these 3 core parts of your child's life can have a massive impact on their mood. So thinking about diet plays a big role in your child's mood. A healthy and balanced diet provides them with the energy and motivation to engage with activities. Exercising every day is vital for maintaining the health and mental well-being of your child. It gives them energy and boosts their self-esteem and confidence. Discipline and conflict. So being a parent is difficult, but especially so when your child is struggling with their mood. Setting boundaries and rules can be especially confusing and feel like walking on eggshells. Even with mood difficulties, children do need boundaries. The best approach is one that is balanced and flexible. So, when trying to manage conflict, try to follow 4 principles: stop and step back, active listening, assertively stating your view, and negotiating and providing choice. So stop and step back. Try not to get sucked into an angry argument that escalates the situation. Take a deep breath, compose yourself, manage your temper, withdraw from the situation if needed. Take a break until you're feeling calm, and explain you will both deal with the situation when you're both calm. Active listening. Give your child the opportunity to explain themselves. Allow them to express their point of view. Try to understand their perspective and what they might be going through. Empathise with their point of view. Being overly critical or angry or passive to your child's behaviour is unhelpful. So being assertive means communicating strongly but fairly. So instead of "where on earth were you last night?" try I worry when you're out late, especially when it's dark. The key to discipline is negotiating rules rather than imposing them. Giving choice empowers your child and helps maintain a good relationship. Choices should be clear, simple, and enforceable. So you either go to school or the library for the day. Discipline and conflict, setting limits. Setting limits on your child's behaviour provides security and comfort. The aim is to teach, not to punish. So the do's: get your child's attention, be clear and specific, give short instructions, give when then commands, use the word now, use a clear, firm tone of voice, so no pleading or shouting, and phrase as an instruction rather than a question. Give choices and alternatives when appropriate, and remember to specifically praise. Praise immediately and enthusiastically when they have been compliant. So the don'ts: don't make vague comments like, you need to behave. Don't fail to get the child's attention, or don't give a long string of commands like, I want you to go upstairs, brush your teeth, wash your face, and get your bag. Don't plead, shout, or use an angry voice, and don't bombard with questions like, can you put away your toys, please? As we spoke about earlier, self-care is vital for managing your child's mood. This means ensuring they sleep well, eat well, and exercise frequently. It is equally important to look after your own well-being by eating, sleeping, and exercising well. Parenting a child with a mood difficulty can really take its toll on you, both physically and mentally. It's important to take time for yourself and do something you enjoy. Spend time with friends. Ask for someone to mind your child so you can take a break and get outside and into nature. It's important to reflect on your own mood and ways of managing stress. If you find yourself struggling, reach out for help. Helping yourself is the first step to helping your child. Supporting your family. The demands of looking after a child with a mood difficulty can put strain on the whole family. If you have other children, they may feel overlooked when all your attention goes to one child. This can lead to resentment. Take the time to explain to your other children and family members what is going on for your struggling child. So you might say something like, John is going through a really tough time. I know it's frustrating for everyone, but we need to be patient and to be there for him. We will all get through this together by supporting and helping each other. It's okay for your other children to be upset and angry. It's important to give them the space to express their frustration and acknowledge it without blaming or criticising them. Try to keep regular activities with your other children and family going, even if your struggling child doesn't want to. Don't be afraid to ask for help and support. What you can and can't do. There are many things you may wish you could do for your child. Unfortunately, you can't. You can't make them get over their difficulty. You can't make them make friends for them. You can't make them go out and be sociable. You can't make them stop thinking negatively. But what is within your control and what you can do is be there for them consistently. You can listen empathically to them and use your active listening skills. You can validate and acknowledge their struggles. You can praise their achievements, no matter how small or trivial seeming they are. You can maintain a connection with them so they have a lifeline. So, another thing that we can do to support children and young people is to model good coping strategies. So, managing our own mood is very important. So, when you're feeling low, be mindful of how you express yourself around your child or young person. So, we want to avoid expressing negative thoughts like, I can't do anything right, I'm useless, versus, this is really difficult, I'm finding it difficult, I need to take a break and come back to this later when I'm feeling better. So that would be an example of a positive coping statement that we can use. We can also model perspective taking. I wonder if you're feeling disappointed or frustrated. So helping our children or young people to label their emotions. Maybe if you thought about things this way instead, or is there another way to think about it? Or saying things like, when I'm struggling with something, I find it really helpful to take a break, do something else, and then come back to it later. Sometimes just suggesting your child's next move. So instead of telling, suggesting, so why don't you try taking a break for a bit and come back to this later? Or maybe I could help you with this if you want to share with me. Another way that we can model good coping strategies is to manage our own reactions. So remember that your child learns the most from you by doing what they see and hear you do. So by managing how you react when your child is struggling, you may encourage them to open up more to you. So try the following. Zip or mouth. Let your child do the talking when you listen attentively. Botox face. Be mindful of your facial expressions as these can give away how you're really feeling. So we want to avoid kind of showing a lot of worry because our child then might shut down and not share things with us. We want to avoid showing anger on our face. The other thing is an Oscar winning performance. So even if it's not how you really feel, pretend that you feel confident and know exactly what to do to help. So support, make sure to look after yourself with your own mental well-being and get support when you need it so that you can model good coping strategies. Compensating for your child. A lot of parents of children with mood difficulties have their own struggles with mood as well. So if you find it hard to manage your own mood, try to expose your child to people or situations where they can learn to model good positive coping strategies. For example, look for other family members or close friends who you believe would be a positive influence on your child. Encourage your child to attend social groups or clubs where there are positive role models, and try to give your child consistent exposure to these positive influences so that they're more likely to learn from them. Bullying. Many children experience bullying, which can have a massive impact on their mood and can lead to the development of a mood disorder. So, bullying can take the form of name calling, mocking, deliberate exclusion from social activities, physical abuse, and aggression, being sent cruel, insulting messages through social media, or having false rumours spread. Many children will find it difficult to admit to being bullied, which can make supporting them difficult. They may feel a mixture of shame and guilt. Be sensitive to your child's feelings and fears, and validate and acknowledge their difficulties. Speak to school staff if you suspect bullying. Relaxation techniques. Sometimes it can be hard for children and teens to let go of negative thoughts of feelings and can get stuck in a never-ending loop. Sometimes relaxation skills can help them to unstuck from the loop and by focusing on the present moment. There are lots of different ways you can support your child to relax. These can include listening to calming or their favourite music, watching a fun, light-hearted TV show or movie. Comedies are sometimes really good for this. Deep breathing. So sometimes by just slowing down our breathing, it can help us to just focus on the present moment. And when we're deep breathing, we tend not to feel anxious at the same time. The other thing we can do is progressive muscle relaxation, where we tighten and release all of our muscles. Visualization, so where we imagine our favourite place, so somewhere that makes us feel really calm and happy. Creative activities like art and music, spending time in nature, being around pets and animals, or aromatherapy, essential oils, pleasant scents. So you can find it in the sample tools section of your learning management system resources to download to guide you through relaxation techniques. Tom's story continued. As well as attending psychotherapy at the Adolescent Mental Health Services, Tom's parents also tried to make changes at home to help his progress. Both his parents make an effort to make time available to chat with him. His mother fosters a connection with him about one of the TV soaps. His parents also make a special effort to be particularly encouraging towards Tom. Noticing any small steps of progress when he watches a TV program with the family, they comment on how good it is to have him there. When he avoids getting into a row with his younger sister, they comment on the restraint he has shown. Both parents work hard not to respond with anger when he's angry, and the atmosphere at home becomes calmer. Tom decides to start football training again, which they quietly encourage without putting him under pressure. His father is available to drive him to and from the training and uses this opportunity to chat with Tom about football and other neutral topics. Tom is still not back at school full time, being late on several days of the week when he cannot or does not get up on time. His parents notice the days he does get up on time and encourages this. Tom's parents have discussed his difficulties with the school principal, and together they've come up with a plan to help him. The teachers accept his being late, but insist that he covers the work that was done in the class he missed. They are encouraging of Tom's efforts, but are clear in their expectations of him. Tom improves gradually, and over the next 6 months, his old self starts to re-emerge. He now trains regularly for football and occasionally goes out with some of the teammates after a training session. He is back at school full time and is sleeping better. He can still be snappy at home at times, but this is nothing like it was before. He can be heard singing and whistling in the bathroom and has to be told to keep his music down. Tom feels he no longer needs the antidepressant medication, but he is advised to continue taking it for at least a further 6 months. He will then have been taking it for 1 year. The plan is to then reduce it gradually over a further 3 months with a view to stopping. His parents are delighted with the changes they see in Tom. They are still uncertain about their own future together, but feel that with all they have been through, they will be able to help Tom cope with whatever decision they make for themselves. So this is a recap on support strategies. While it's difficult to see your child struggling with their mood, there is lots you can do to support them. Try to recognise when they're struggling, provide a safe space for them, maintain a connection with them, actively listen, encourage and praise successes, encourage social activities, support with diet, sleep, and exercise, model positive coping skills and interactions, and help them to relax and switch off. As well as supporting your struggling child, remember to always look after your own well-being too. Supporting your child means supporting yourself. Where to get support? It can be difficult to know when to get specialist support for your child. The following can be used as a guideline to know when it's time to get help. So, when you see your child isolating themselves or withdrawing from others, that can be a sign that support is needed. When we see persistent low or rapidly changing mood, difficulties getting out of bed or sleeping a lot during the day, loss of interest in things they used to enjoy, refusing to attend school, not wanting to be around friends, persistent negative thoughts about themselves or the world, hopelessness and not looking forward to things the way they used to, engaging in self-harm, and expressing wanting to be dead. So if a child or young person is expressing any thoughts of harming themselves or expressing things like, I would prefer if I was dead, or it would be better if I was dead, then we really need to seek urgent support from the GP. So referral to your local mental health services can be obtained through your GP. The other services are available is, I suppose, out of hours, accident and emergency departments. So if your child is self-harming or expressing suicide, your nearest A&E department can provide emergency support to keep them safe. Your GP services are very important. As discussed, a GP can provide direct support or refer a young person onto a community mental health service. There's also psychology, counselling and psychotherapy services. A list of accredited psychologists, counsellors and psychotherapists throughout Ireland can be found using the links below. So find a psychologist in the Psychological Society of Ireland, or find a counsellor in ACP, or find a psychotherapist with the Irish Council for Psychotherapy. There are also a number of confidential helplines that provide a listening service to people in distress. For children under 18, they can talk with Childline in confidence about anything that might be on their mind. So the number is 1800 66 6666, or text help to 50101. Where to get help, community services and useful readings. So in the third-party resources section of your learning management system, you can find a booklet to download that provides guidance and general information about relevant community services that you can contact or encourage the child adolescent to contact for support. In addition to that, we suggest some books which we believe you might find useful in your journey of supporting a child or adolescent with mood difficulties. Now, a summary of what we've discussed in this webinar. In part 2, we covered a lot of different topics and went over a lot of information. So we covered interventions for mood disorders. We talked about lots of different ways professionals might support children and young people with mood disorders. We talked about psychoeducation, changing and supporting family relationships, managing negative thoughts, social skills training, medication, and relapse management. We also talked a lot about strategies for supporting mood. There's lots you can do to support your child. We talked about providing a safe space, actively listening and validating feelings, encouraging and praising efforts, supporting with sleep, diet and exercise, modelling positive behaviours and supports, encouraging social activities. We also talked about where to get support. There are lots of organisations that you can reach out to. There are books and resources for both you and your child. However, if you are concerned that your child may be experiencing a mood disorder, your GP is a very important point of contact, and your GP can refer you to mental health services. Outside of that, we talked about accessing accident and emergency services if your child is self-harming or you feel that they're at risk. So, a summary of part 1 and part 2. We went through some helpful information about mood difficulties in children and adolescents. We also talked about evidence-based interventions and support for mood in children and adolescents, as well as additional supports, resources, helpful books and groups. In part 1, we discussed what a mood disorder is and when mood difficulties require support. We talked about the cognitive, affective, physiological, behavioural, and relational aspects of different mood disorders. And in part 2, we covered a range of interventions and supports which can help with the treatment of mood difficulties. We talked about tips and strategies of how you can help your child or young person to manage their mood. And we also talked about where both you and young people can access support. These are the references for this webinar. Thank you very much for your time and attention during today's webinar. We hope you found it useful. Should you wish to add structure to your caregiver routine, please refer to the sample tools and third-party resources associated with this webinar, which have been conveniently uploaded to your learner area of the learning management system. Please keep in mind that these are only samples, and with your newly acquired knowledge, you may choose to use these in whole or in part, or research alternative resources and tools yourself. If you have questions in relation to any of the topics or areas raised during today's webinar, please feel free to contact our team by emailing clinicaldepartment@newahealthcare.ie. Thank you very much for your time and for listening. I hope that you found this webinar useful.